Tend Health is a full-service healthcare provider and technology company, and its founders include my food bag entrepreneurs, Cecilia and James Robinson. The husband and wife duo are both co-CEOs of their new venture Tend, which has just turned 2. Cecilia Robinson joins me now. Welcome, Cecilia. You raised $15 million in early 2021 to buy some GP practices and now have 4. When are you likely to buy more? Where's things at with that?
Yeah, look, we're being actively approached and considering currently a number of opportunities, and we're in a privileged position where clinicians are really considering us as a natural pathway for their business, because there are a lot of challenges currently in our sector. And so, look, watch this space. There's quite a lot on the go at present, and I'm really excited about what the future looks like and the impact that we can make for New Zealanders across Aotearoa.
Do you have a set number of practices you'd like to acquire by a certain time, though? Or?
Yeah, look, we want to be nationwide in terms of the delivery of our service, and I think that's a really important objective for us, because in healthcare, you really need that scale to be able to make a real difference. To deliver the best healthcare experiences at every level for the business, we need to be nationwide. And saying that, there are always going to be rural areas where you won't have a practice locally available to you. And so providing services into those communities is equally important. And there are a lot of communities currently. I was looking at a survey yesterday where, the practice book is closed and, there is no access to healthcare. And so all of those challenges are at the forefront of our decision making as we go for this next period of growth and innovation.
You also raised more money in May this year. What will that money fund?
Acquisition. Yeah, so look, we've made it pretty clear with our objectives, and I feel like, we've been really focused on delivering 2 things over the next period, and what we've done up until now is the same. We've been really focused on acquisition, so providing a succession plan for clinicians. And I think that when you look at the market currently, there's a lot of clinicians looking for that succession plan, but they don't have a clear pathway. So acquisition is important, but the other important aspect of it for us is pharmacy. And look, that is something that we're working actively towards. Tend has launched medications in our app, which is a really important aspect of being able to deliver the best healthcare experiences. And when you look at healthcare in general, one of the biggest problems that we have is with medication compliance, medication access. And so through Tend, you will be easily able to manage your prescription needs. And so we built out a whole platform, which means that, say you are on regular medication, looking at someone like myself, it could have been birth control, for example. And the app will tell you, hey, look, this is when your doctor prescribed the medication. This is how many tablets that you've got, and now you need a repeat prescription for that. And it will prompt you, and then we will deliver that prescription through our network. And so when you're thinking about the process there and you're thinking about the complexity that goes into that, there's many medications that a doctor or a clinician needs to oversee, or they need to sign off, right? And so we'll have some types of medication that says, hey, look, we're currently seeing you for, say, diabetes or hypertension or whatever it is, right? And we know that you're due for a prescription, but actually this requires a clinical check because we actually need you to come in and take your blood pressure. Or we need to discuss with you what your mental well-being is like right now. So building in all of these things into our technology is a phenomenal way to be able to resolve a really difficult problem that we see in healthcare in terms of compliance, medication management, and all of these things. So we're really excited about what that looks like for New Zealand over the next period, and already seeing just phenomenal feedback from our customers in terms of how they're using that. So it's very exciting, and that's definitely where we'll be spending our money.
So you've hired pharmacists then to help deliver on that?
Yeah, totally. Yeah, so we've got a third-party pharmacy that provisions the products, and we employ our own clinical pharmacists. And, look, I think one of the problems in healthcare is that for so long when we think about going to seek primary healthcare, we think, we're just going to go and see my GP, right? And so that's what people say, I'm going to see my GP. But actually, there are a range of other clinical professionals that you should see to be able to, that are, in some instances, are better suited to talk to about the specific, needs that you have. And so through our technology, we're going, okay, well, actually, you've got some complex medication requirements. And we see this currently with our patients. And so say if you're on regular medication, which is which you're taking, say, 3 or 4 or 5 different medications, then our clinical pharmacist will go in and do a review of the medication that you're seeing, and our GPs will prompt that and say, look, we'd like this patient to be seen for a clinical review. And so what happens is our clinical pharmacist reviews the type of medication that the patient is taking and ensure that it's the right medication, taking it in the right way at the right time, right?
So have you got other add-ons in the pipeline as well beyond medication?
It's one of our next key things that we're looking at, which sounds quite simple, but currently doesn't exist in the system is, okay, well, I have an urgent need. I need to be seen today by a doctor. I'm really unwell. I've got a preventative healthcare, issue that I have, also something like I need to have a smear or whatever it is, or I have a proactive healthcare need that I need to manage, like diabetes, right? And so in the TENDAP, what we'll be doing for you is saying to you, well, what is your presenting complaint? And then you can tell us which category it fits into. And then what it will display to you is the right person for you to see for the needs that you have, and then the ongoing management of that. So say if you're coming in to see us because you're getting your smear done, and so we're assigning you to see a nurse for your smear, but we're also at the same time saying, well, look, actually it's flu season and it's, we actually need to get you vaccinated at the same time. How about we vaccinate you? So kind of all of this intelligence that currently isn't displayed to patients is, and I keep saying, and it's a really random analogy, but when I go to book an appointment to get my hair done, my hairdresser's technology goes, oh, well, would you like a cut, or would you like a blow wave, or would you like a colour? And then it assigns the right person with the right skill set to deliver on the service that you're requiring. But in healthcare, we don't do that. And that means that the entire funnel goes into GPs. And so what we're looking at doing is saying, okay, well, all of these things, for example, mental health, right? There's quite a broad spectrum of mental health illnesses and issues that people experience, from some presenting complaints that could be managed by like a mental health coach to, a full-on psychiatrist. And so we can make that assessment to say, no, actually, we can actually intervene earlier with you and present you with a mental health coach that you should see every week or every 2 weeks, 20 minutes every week. And it's a cost-effective solution for you to manage your health. You don't have to go through to your GP or the psychologist. We can actually assign a better person to you.
So there's an acknowledged shortage of GPs. Are you finding that an issue as well?
I think globally everyone is finding it an issue. And look, I always love a good challenge, right? How do we attract people? And so I think we've been really lucky in the fact that we've been able to retain and attract a lot of really amazing GPs. But again, what I'm finding is really interesting is that we as non-clinicians look at GPs and we kind of think they're all quite similar. They're all GPs, right? But what I've learned is that they all have got different skill sets and abilities and interest areas. And so you have, GPs who are really interested in ongoing management of complex health issues, and they like dealing with that, and they like seeing the same patients, and they like building that relationship, right? And then you have doctors that are like, actually, no, I prefer to deal with issue and then resolve, and then issue and resolve, and issue and resolve. And so, the secondary doctor, will put more in our urgent queue, right? Because you can see someone every day and it's next person. And while our other clinicians are maybe more suited to be seeing one of our practices in person dealing with patients. So that's a really interesting observation in terms of how clinicians like to work and also what their lifestyle's like. Pre the pandemic, it was just, working inside an office or inside a clinic, often by yourself in a room. And, new clinicians coming out are looking for flexibility and other ways of working. And we need to provide an environment that they can contribute to, because as a population, we desperately need them. Any GP practice out there is currently kicking and screaming about the level of adjustments to our capitation funding. And I think that is really valid. There's kind of this underlying expectation on our clinicians to just kind of keep working and doing the right thing at the personal expense of burnout. There's a couple of clinics that we've been talking to where their doctors say, look, I never have a day off because even when I go on holiday, I can't give my workload to anyone. So guess what? A patient's referral comes in, the results come in, all of these things with the prescription requests come in, and I'm the only person that can deal with that. So, how do you resolve those complex issues, right? And that's not being appropriately looked after within the current system. And there's probably some underlying problems there that I'd say is that the way that the funding has been set up isn't, it's about the clinic rather than the patient. And what should happen is that the funding should follow the patient, right? So depending on your ability and depending on, how physically, how much healthcare you require, that funding should follow that patient, because we have patients with really complex health needs that really need to be seen a lot. And then we have patients that are really low touch. And so we need to be able to ensure that the patients that need that ongoing care, that we front with that. And so do I think it's fit for purpose? No. Is that a hindrance from us in terms of where we're taking, TEND and our focus on delivering that best healthcare experiences? No. We don't want to be, that's not something that is a major focus for me. All we're focusing on is how do we do the best thing by our population, by our enrolled population. And that's really my focus.
Just finally, Cecilia, how has the venture turned out in terms of how you thought it would 2 years ago?
So I think I did a few interviews when we launched TEND, and people were like, this is quite random. Like, you've done childcare and you've done, grocery, and now you guys are in healthcare. And, it's quite an interesting journey for me. And I guess it's going back to where I started, is that I think when you go into health, you become a health person. And I'm really proud to be in health. I love the sector. I've never felt the way that I feel about health before. I've never seen greater challenges and more opportunities to provide, be able to resolve problems, right? Everywhere I look, there's a problem, and I go, oh, this is interesting. How do we fix this? And so I really think about what our greatest legacy is to our family, to our tamariki, to our community. What is our best legacy? Like, how can we really deliver for them? And, transforming healthcare in New Zealand is there's nothing else I'd rather do. So I think what I didn't know 2 or 3 years ago when we launched TEND would be that this is my forever. I'm always going to be here. And that's something that fills me with immense joy. So, yeah, watch this space. It's going to be a long journey, and I'm really enjoying it.